continue with teaching learning methods. So in the last class we were discussing about micro teaching. Today we'll be seeing about the different clinical teaching methods. Clinical area poses a great challenge to nursing teachers, and as we know, clinical teaching is very important in nursing as psychomotor skills enjoy a dominant position in developing the professional competencies of student nurses. Clinical teaching is defined as an individualized or group teaching to the nursing student in the clinical area, and it can be done by a nurse educator, a staff nurse, or a clinical nurse manager. Let's see a comparison between classroom teaching and clinical teaching. So clinical teaching, it is a small group method, while classroom teaching is a large group method. Clinical teaching focus on the patient, while classroom teaching doesn't focus on the patient. Clinical teaching is the application of the knowledge, while classroom teaching is the acquisition of the knowledge. Clinical teaching is based on clinical reasoning, while classroom teaching is based on theoretical framework. In clinical teaching, we have a small teacher-student ratio, while the teacher-student ratio is larger in classroom teaching. Students are more active in clinical teaching, while we have more passive students in classroom teaching. Clinical teaching is more interactive, while classroom teaching is less interactive. Coming to the principles of clinical teaching. So as we said earlier, clinical teaching is a vital component in preparing nursing students for professional practice. So that is the first principle. It is a vital component of preparing nursing students for professional practice. The next principle is clinical education should reflect the nature of professional practice. So whatever clinical education is being given, it should reflect the actual nature of professional practice. That is, it should assist students to acquire critical thinking, problem solving abilities, psychomotor abilities, which are essential for nursing. The next principle says that clinical teaching is important than classroom teaching. So as we said, unlike classroom teaching, clinical teaching provides opportunity for transfer of knowledge to the practical situations and provides real life experiences. So classroom teaching is just theoretical framework, while in clinical teaching we have more application component of the knowledge acquired. The next principle says nursing students in the clinical setting is a learner and not a nurse. So many a times students are considered like a working nurse, so it shouldn't be done. They are learner and not a nurse. Sufficient learning time must be provided before performance is evaluated. So whenever a performance is evaluated in the clinical area, just like a written demonstration, so adequate learning time should be given to the student nurses. Clinical teaching must be always supported by a climate of mutual trust and respect. So there should be mutual respect between the teacher and the student. Clinical teaching and learning must focus on essential knowledge, skills, and attitudes. So here basically we are enabling them to think like nurses, act like nurses. So that should be the primary concern. Quality is more important than quantity. So it is, or we are considering the quality of the nursing care rendered rather than the quantity of nursing care. Nursing students may experience stress and anxiety in the clinical situations, especially when they are newly exposed to a clinical teaching situation. So that should be considered by the teachers. Now let's see the different clinical teaching methods. So they are bedside clinic, nursing rounds and reports, nursing care conferences, demonstration, nursing case studies, process recordings, laboratory method, nursing assignment, field trip. So now let's see one by one. First about nursing care plan. So nursing care plan, you must be very familiar with this thing. It is actually what we do from the initial times of nursing. So it is one of the most important or effective clinical teaching method. Whenever nursing care is rendered through a nursing care plan, it helps the student to develop the basic nursing skills like assessing the patient's condition, formulating an effective nursing diagnosis, prioritizing the needs of the patient, planning care for the patient, implementing the care with rational and evaluating the care. So these are the basic steps of nursing care plan, and it enables the students to acquire all the steps by applying this nursing care plan. This method helps a student to recognize the importance of rendering continuous and comprehensive care in a systematic manner. So as we know, the nursing process, which is the basic of nursing care plan, it is a systematic way in assessing the patient and providing continuous care to the patient. Effective use of this method also fosters creativity and professionalism among nursing students. So whenever a teacher is teaching a care plan, the teacher has to conduct a discussion and reach a consensus regarding the format as well as the content in accordance with the guidelines formulated by international bodies like NANDA. So whenever a care plan is assigned to a client or a student, the teacher should initially explain what is expected out of them or what are the guidelines in order to write the care plan based on NANDA. Nursing teachers should also maintain an international perspective as the nurses are to work on a global basis. Teachers should provide adequate help and guidance to the student in preparing and implementing care plans. So in the initial time, student may have many difficulties in implementing nursing care plan. So adequate support should be given to them. Students should be given opportunity to discuss the care plan with teachers and peers for clarifications. So this discussion sessions is an excellent opportunity in order to clear and rectify clarifications. Students should be provided with adequate time to prepare, implement, evaluate and modify the care plan according to the patient needs. So it should not be stringent. Adequate time should be provided to the students in order to implement the nursing care plan. Beginners should be given opportunity to write simple, short care plans on simulated situations or real life patients. So in the initial or in the beginning time, complex cases should be avoided and they should be given either simulated situation and then they can progress into real life situations. The number and the complexity of care plans can be increased gradually. When used judiciously, nursing care plan is an excellent, cost-effective and learner-centered clinical teaching method. Now coming to the next method, which is case method or nursing care study. So case study is a comprehensive study of an individual and it centers around the patient, his problems, his needs and the nursing care he receives. So in nursing care plan, we just focused on the patient needs and how we implement as well as evaluate the nursing needs. While in case method, it is a more comprehensive manner in order to take care of the entire patient needs as well as focus on the disease condition also. Coming to the definition, it is the blueprint of nursing care rendered by a nursing student to a selected patient for a particular period by following nursing process approach with an intention to develop comprehensive nursing care abilities. So let's read it once more. it is the blueprint of the nursing care rendered by a nursing student for a selected patient. It is for a particular period of time. It is in accordance with the nursing process approach, and here the intention is to develop comprehensive nursing care abilities. In order to make students familiar with this method, the teacher has to issue proper guidelines necessary for conducting the case study. Guidelines are to be provided regarding the format and the content, the criteria for patient selection, involvement of patient's family in the care, role of the teacher, role of other health team members, duration of care, available resources, evaluation of care study, and peer group involvement. So these are the different guidelines provided by the teacher to the student in the beginning of the nursing care study. The student can select the patient, and this is done in consultation with the teacher. The teacher should also ensure that patient's immediate environment is conducive for continuous care. So whenever a patient is allotted, the teacher should make sure that the environment is conducive for conducting this particular care study, and the patient will be available to the student during the period of care. After selecting the patient, the student has to give continuous care for a minimum of 7 to 10 days. So this is the actual period of care, which is 7 to 10 days. If there is an opportunity in order to assess the patient's condition during the first follow-up visit to the hospital, arrangements should be made up for the same. So once the patient is discharged, we give discharge education to them, and the student should be given an opportunity in order to follow up the patient during the next follow-up visit if it is available or if it is possible. Student has to plan and deliver the care in a systematic manner using the nursing process approach, and the students can also involve the family members or the caregivers in the care. They can seek help from other health team members like physiotherapists, the respiratory therapist, or any other health team members who is involved in the care of the patient. Students are required to gather all information regarding the patient's disease condition with special reference to the nursing care. So this is what makes it different from nursing care plan. Here we focus on the patient's disease condition also, and the student has to study the disease condition in depth. The teacher should see the progress of the case study as planned and give necessary guidance whenever required. By the end of the stipulated time period of care, the student should be given time to submit the care study. So after 7 to 10 days of care, they should be given time in order to prepare the content and present. The student should present the case study in the class, and after the presentation, a discussion is conducted. It is supervised by the teacher, and all the peer members can participate actively in the discussion. The teacher should then evaluate the case study, and this is done according to the predetermined criteria. An ideal case study should have the following contents, which is information regarding the biodata, disease condition, investigations, management, related literature, nursing care planned and implemented according to the nursing process, discharge summary, and health teaching that is provided to the patient. So these are the components of a nursing care study. The number of the case study may vary according to the college protocol or the university protocol, but ideally there should be a minimum of 2 case study per academic year. Nursing case studies, as we discussed, it provides an opportunity to learn clinical skills through a problem solving approach. Now coming to the next method, which is bedside clinic. So bedside clinic, it is an organized clinical instruction in the presence of a patient. So in bedside clinic, it is basically conducted at the patient's bedside, and here we have the presence of the patient, and the patient is also actively involved in the discussion. So based on the type of topic, bedside clinic can be medical, nursing or combined, and it is basically a teacher-centered method. It is meant for small group of students. So before starting a bedside clinic, the name of the patient, the relevant details, that is socio-demographic details, and the venue of this bedside clinic should be informed to the student priorly. Depending upon the convenience of the patient, it can be conducted either at the bedside or a nearby clinical teaching room. Prior permission should be taken from the patient, or prior consent should be taken from the patient or the relatives for conducting bedside clinic. The patient that is selected should have typical signs and symptoms regarding the disease condition that is to be discussed, rather than having unusual or vague symptoms. The usual duration is between 30 to 45 minutes. The students have to gather around the patient in an informal way, otherwise it may induce tension in the patient. The patient should be taken into confidence. Adequate rapport should be built between the patient as well as the participants, and throughout the discussion, nothing should be done or nothing should be said that may embrace the patient. If the patient's condition permits, he should be given an opportunity in order to explain what happened to him, or what is his concerns, or what are the signs and symptoms he faced. So such discussion would be very, very beneficial to the group. The presence of the patient, it is not required during the entire period. Once the initial discussion is over and the assessment is over, the patient can go to the bedside. So before going to the bedside or before going to the side of the patient, the teacher can explain some details regarding the basic information, the family background as well as the past medical history, the condition of the patient, signs and symptoms, line of management and nursing care. So these things are to be discussed only in the presence of the patient. While discussing, the teacher can also involve the students, especially the particular student who is taking care of that particular patient. After explanation by the teacher, students are allowed in order to interact with the patient so that they can clarify their questions or doubts. This is followed by a common discussion, and in this discussion the teacher will be clarifying the general doubts as well as queries of the students, and the bedside clinic ends with a summary, recapitulation of the important aspects as well as the feedback from the students. So finally, the entire summary of what happened as well as the recapitulation of what new things has been learned is done, as well as a feedback is obtained in order to improve the upcoming bedside clinics. Coming to the phases of bedside clinic, the first phase is preparation phase. So in the preparation phase, you have to determine the purpose of the clinic. So what are the objectives of this particular bedside clinic? The patient with relevant signs and symptoms are to be selected. Consent is to be obtained from the patient. You have to select the setting, either at the bedside or a clinical teaching room. Appropriate instructions are to be given to the students regarding the conduct of the bedside clinic, and all the necessary patient-related information is to be collected. The next phase is conduction phase. In conduction phase, initially we have the introductory phase. So here, acquaint the students regarding the patient's background, other related data about the management, significant observations to be made, and the questions to be asked. So this is done before going to the bedside, and here you have to orient the student nurses regarding what is to be done or what is to be asked during this particular bedside clinic. The next phase is patient-centered discussion. So data collected is analyzed, needs and problems of the patient is identified and solved using a problem-solving approach. So the initial data that has been discussed during the introductory phase, that is confirmed as well as that is explored further in the patient-centered discussion, and we identify the patient needs as well as we try to solve the patient needs. The next phase is post-clinical discussion. Here the students have to discuss various strategies and problem-solving techniques suitable for the patient and the design interventions. So we have identified the needs of the patient, and after identifying, the students will be coming up with different strategies in order to achieve this patient needs. And in the last thing, we have conclusion. Here the students and the supervisors, they come to a conclusion about the management of the patient with a particular disease condition. So after all this discussion, a general consensus will be made how to take care of a particular patient with a particular disease condition or a particular need. So that was about bedside clinic. Now coming to the next method, which is nursing rounds. So nursing rounds, it is a modified compact version of bedside clinic. So it is very similar to bedside clinic, but it is a compact or a mini version of bedside clinic. In bedside clinic, a detailed discussion regarding the nursing care of a single patient is done, while in nursing rounds, we discuss the nursing needs of a large number of patients within a stipulated period of time. The ideal duration of nursing rounds in a ward is about 45 minutes, and in this 45 minutes, we will be discussing about 20 to 25 patients. While in bedside clinic, we used 40 to 45 minutes to discuss regarding one single patient. So that is the difference between bedside clinic as well as nursing rounds. For a successful nursing rounds, the student have to know all the patients in the ward. So that is to be done initially. So students have to know each and every patient in the ward, and then attending a nursing rounds would be beneficial rather than blindly going for a nursing round. The patient's dignity have to be preserved throughout the nursing rounds. In nursing rounds, the nursing teacher or the head nurse who knows the details of the patient briefs the nursing care. So usually in wards it is done by the in charge or the particular nurse who is taking care of that particular patient. In the discussion, the staff nurse or the student nurse who is taking care of the patient for a few days are allowed to contribute some genuine points and have to answer the questions of the group. So after giving the basic information about a patient, the nurse who is responsible to take care of that particular patient will be given an opportunity in order to explain further as well as answer the clarifications from the nursing care from the group. The group that discuss the nursing care aspects in brief. The senior nursing personnel in the group or the nursing administrator concludes the discussion by giving some opinions, needed guidance and instructions. So the person who is leading the nursing rounds, usually the in charge, she will conclude the discussion and she will give suggestions in order to improve the nursing care of that particular patient. So that was about nursing rounds. Let's see one more method, which is conference. So we have attended many conferences and we are well versed what happens within a conference. As you know, conference is a two-way process where teaching and learning go simultaneously. So it is a method in which a teacher meets a small group of students in order to achieve a clinical teaching objective. So we have predetermined clinical teaching objective, and in order to accomplish this teaching objective, the teacher will be meeting a small group of students. It is held under the chairmanship of an expert who can be a teacher or a senior member of a professional group. So it can be done by a teacher or a student or a sister in charge or a doctor or anyone who is a senior member from a professional group. Conferences can be of different types. Let's see one by one. The first is direction giving conference. So here the leader gives information and directions specific to the assignment. So whenever we have a patient or a patient with a particular need, in order to achieve that needs, what are to be done, so or how is the care to be implemented, such directions are provided in direction giving conference. Then we have client centered conference. Here the members identify problems and attempt to arrive at solutions and decide on the course of action. So here the patient needs are identified and the different strategies in order to achieve that patient needs are discussed, and the total duration of care is planned. The next is reporting conference. So here the participants give progress reports. So when we have a care plan and we are in the halfway of the care plan, a reporting conference is done where we discuss how much we have progressed or what we have done, what we are going to do further. So such things are discussed in a reporting conference. The next is general problem conference, where participants express their impressions about work situations and try to resolve work or personal problems. So this is usually a conflict resolution kind of thing, where the staff or the employees will be discussing their concerns or their problems at work and will be trying to come at solutions in order to resolve that problems. Then we have nursing care conferences, where the members collaborate for problem-oriented nursing care. So coming to group conference, it is defined as a meeting of professional persons. A subject of common interest relating to the clinical area is discussed by the students under the guidance of a nurse educator. So commonly it is a gathering of professional persons, and here a common problem to the profession will be identified and it will be further discussed in order to gain insight regarding the problem. It is basically a small group teaching method. Subjects selected for the group conference should have clinical orientation and should enrich the clinical skills of the students. So rather than theoretical knowledge or a theoretical framework, we should focus on those problems with clinical relevance as well as those problems which may contribute to improving the clinical skills of the participants. So the subjects selected may include a particular disease condition, common errors that may come across like medication errors, deficiencies noted in the clinical area, updating of procedures. So whenever procedures are updated, in order to communicate those updations to the group, patient care implications while administering drugs, cost-effective use of supplies and equipments, infection control, proper waste disposal manners, ward routines, interpersonal relationship with patient. So these are the usual problems which are opted for group conferences. During the discussion, the teacher has to assess the pros as well as the cons of the suggestions put forward by the student before giving the opinion. So whenever a discussion is made, many opinions will come across, while or before summarizing or before concluding the conference, the teacher has to assess both the pros as well as the cons of the opinion and then generalize the opinion. by providing an opportunity to express the innovative ideas and to refine clinical skills. Group conferences make clinical area more interesting, and it will generate more interesting in the teaching and learning activity. Now let's see what is individual conference. So individual conference, it is a clinical teaching method which focuses on the overall development of a single student. Group conference, we had a small group of students with a common interest, while in individual conference we focus on developing the clinical competency of a single student. Depending upon the concept as well as the felt need of the student and the preparation from the side of the teacher, it can be classified as unplanned or incidental conference as well as planned conference. So it can be of two types, unplanned conference or incidental conference as well as planned conference. So whenever the teacher or the staff nurse recognizes the need for prompt guidance incidentally by observing the student's performance, or when the student realizes the necessity of immediate guidance and seeks for it, an unplanned conference takes place. For example, if a student is doing a procedure and she does it wrong and a teacher observes it, there is a need for immediate correction, right? So in such situations, an unplanned conference may occur. Unplanned conference is very short. It emphasizes on solving the problem or to deal with situation of immediate concern. So it basically deals with solving that particular concern, and it is very short. The remaining general aspects of the problem are discussed afterwards informally or in a planned conference. So whenever a particular mistake is observed through an unplanned conference, the teacher rectify it immediately, and further instructions can be given in the class to the whole group using a planned conference. Planned conference is more systematic and predetermined. In each clinical area, individual students should have prescribed number of planned as well as unplanned conferences. For conduction of planned conference, prior intimation is to be given to the student about the time and the place as well as about the topic that is to be discussed. Individual conferences, they deal with problems like nursing care ability, the level of the performance of the student, achievement of the students, activities and assignments related to the clinical experience. So as we said, it focuses on the overall development of the students. So here emphasis is given on a student's nursing care ability, level of performance, achievements of the students, activities and assignments related to the clinical experience. Individual conference, it provides an opportunity for the student to know about his achievements and to express difficulties or problems he is facing, especially in relation of acquisition of clinical skills. So it is an opportunity for the teacher to correct the student, as well as it is an opportunity for the student to say about his concerns or say about his needs. Now about process recording. So process recording is one of the familiar thing what we do in mental health area. So process recording is also known as patient-nurse interaction interview. It is a written report of conversation that occurred between the patient and the professional nurse when they are working together towards a common objective. So it is basically recording as well as reporting all the conversation that happened between a nurse as well as a patient. Process recording is being utilized as a tool to help in assisting nursing students to acquire understanding and competence in IPR. So it is basically done in order to improve interpersonal relationship. So here the nursing student is recording the entire process and then analyzing and evaluating the process in order to improve or correct the deficiencies in maintaining IPR. Coming to the official definition given by Hudson, he defines process recording as an exact written report of the conversation between the nurse and the patient during the time they were together, and a record of the nurse's feelings about what was going on at that time, and as far as possible how the patient said what he did. So it is recording the conversation between the nurse and the patient, as well as the feelings of the patient as well as the patient. Let's see the phases of process recording. The first phase is preparing the student for process recording. In this phase, the teacher must help the student in order to clearly define the objectives to be accomplished through a patient-nurse interaction. The student should be motivated in order to use process record in order to accomplish the desired goals. Many a time student would be not much interested in recording all this conversation. So they should be motivated in order to participate in this particular teaching learning process. The student should be helped to write a process record. So that is done in the initial phase, which is preparing the student for process recording. The next phase is recording the nurse-patient interaction. So it consists of 4 parts. The first thing is the exact verbatim report of the patient-nurse conversation. So we write in quotations what the patient said. The patient said that I have pain in the right area, right coastal area, or whatever the patient has done, that is recorded in quotations, as well as the nurse's verbatims are also recorded. The next thing is the student's conscious feelings and her interpretation of the patient's feelings. So the next thing to be recorded is what the student felt, as well as what the student thinks the patient must have felt. The next component is analysis for meanings and clues to the patient needs. And the last component is the instructors and the students' evaluation of the total process. So these are the basic components or the 4 parts of process recording. The necessary conditions for process recording are: there should be a minimum of 2 people. Patient should be reassured that the confidentiality would be maintained. The student must be impressed with the importance of keeping the interview material confidential. So the student should be explained that it should be maintained confidential, it should not be revealed to others. Recording all the verbal interaction, and that should be an exact copy of what happened. Notation on thoughts, feelings and actions that the student experiences during the interaction. So not only the verbatim, the feelings, the thoughts and the actions that the student felt during the interaction should be also recorded. Notation of the interaction done as soon as possible after interaction has occurred. So once the encounter is over, immediately during whatever has happened, the student should record the feelings, what he felt during as well as after this interaction. The last phase is evaluating the nurse-patient interaction. So after the interaction data has been collected by the student, it is to be analyzed. So analysis, as you know, it is a very time consuming process, because the teacher and the student has to read all these verbatims, all these feelings, all these actions, and then analyze what is wrong, what is right. So during the process of analyzing the recordings, the objective of the learning experience should be clearly focused. So we should not divert from the objective. We should be focusing on what the initial objective was. The teacher must discuss the process recording with the student. Now let's see the format of the process recording. The format includes goals for working with the assigned patient, important factors in the patient's personality development, that is from the history, somatic therapies as well as the medications that the patient is getting in the past as well as in the present, date of each recording, amount of time spent with the patient during each recording, describe briefly the setting or the situation previous to the conversation. So whenever a conversation happens, what happened just priorly to that, that will have much influence on the conversation. So that is to be stated. Identify the patient needs as represented by the behavior. Identify the mental mechanisms that you think the patient is using and give examples. For example, when a patient says something, you have to analyze what might have the patient thinking about, or what is the defense mechanism or the coping mechanism that is involved here, and then give example. After completion of his assignment, comment on how well you were able to meet the goals which you have set up for working with the assigned patient. So once the entire thing is done, the student has to notify, or student has to express how well he felt. Evaluate the process recording as a learning experience for you at the end of the assignment. So that is about process recording. Let's stop here today, and we'll be continuing with the other methods in the next class. So have a nice day. Thank you.